friends. My name is Dr. Judy Goldstein, and welcome to the Lions Vision Research and Rehabilitation Center. I'm so glad you can join us today on this tour of our center. When patients first arrive at the center, they immediately notice the map of MD22, and we often reference the fact that the Lions are responsible for supporting our research, teaching, and clinical mission. But just next to that is the plaque referencing Dr. Arnold Patz. And many of you know if it was not for Dr. Patz, we would not have the center here at Wilmer. Dr. Patz always believed that patients of all levels of vision and all ages should always be helped, even when medicine, laser, and surgery were not an option.
Hi, my name is Tanya Brown. I'm the patient service coordinator here at Low Vision. My role is to welcome patients, check them in, schedule appointments, answer any questions that patients may have leading up to their appointments.
Join me on the tour. Come with me. When patients sit in the waiting room, they immediately notice all the beautiful artwork that is present. All of the artwork is done by patients with vision impairment. The idea behind displaying this artwork is that we are not defined by our limitations, but rather our ability to reinvent ourselves and thrive when confronted by the challenges of life. Our patients are amazing, and depending on their level of vision loss, they can create different levels of art. This is a piece of art that was done by a lion. Someone who was totally blind was able to create a mosaic using tactile solutions. And one of our other patients, who was legally blind, who still had form perception vision, was able to continue to paint, and even to this day, still paints. When patients first come to the Low Vision Center and they come into the examination room, they often don't know what to expect. They're frightened, they've been diagnosed with a condition maybe perhaps they're unfamiliar with, and they don't know what the future holds. So we spend a big part of the time during the evaluation, usually about 15 or 20 minutes, just talking, finding out what their life is like, what their family situation is like, where they're living, and what their demands are. Do they work? Do they not? What kind of things do they need to do? Do they need to read or walk more safely or watch TV or be able to participate in athletic activities? And so that first part of the visit is just spent identifying what the things are that they wish they could do more easily, and also developing a rapport with patients because they need to be able to trust us to know that we can really help them. And then we turn to the examination, which is very familiar to many of you. We take many measures which are typically traditional. The first we take is visual acuity, the measurement of information depending on the size of the information. And so we measure their acuity in one eye and then the other eye, and we can determine their resolution ability. But this is only one part of the equation. Even though patients may be able to read very, very small print, sometimes they still have trouble doing activities because their contrast sensitivity is significantly affected. In conditions like macular degeneration and glaucoma, oftentimes patients can have 20/30, 20/40, relatively good acuity, but very severe loss in contrast sensitivity. And normal contrast sensitivity is all the way down here. And we have to explain to patients that eyeglasses may not be the solution for them because eyeglasses might make someone be able to read print that is smaller, but may not enhance the contrast. And so we spend a lot of time, of course, checking for glasses, prescription changes, because the reality is for patients to accept alternative strategies, they need to be sure that glasses are not the ultimate answer for them. And so we spend some time checking their refraction, and so we use spectacles on their face to be able to allow them to turn their head, and we use various lenses. Many of you probably remember this from your eye doctors from many years ago. This is the way that we check people's prescription and determine whether or not we can improve their resolution ability. We start with very large print, and we ask patients to read as quickly and accurately as they can. And when they can get to the bottom of the first side, we move to the second side and we ask them to read all the way down. We're not only looking for resolution ability, but we're really looking for fluency, because sometimes it's not just good enough to be able to read small print, it's necessary to read it efficiently and fast enough to be able to comprehend. So after we check their refraction and provide their best corrected visual acuity, we begin to think about whether or not we've been able to meet their goals. And when Glasses alone will not solve their problem. We then need to move to visual assistive equipment, the use of different types of lenses and devices in order to meet patient goals. Reading is one of the most common complaints in patients with vision loss. And when glasses don't solve their problems or get them all the way to read the small print, it often requires the use of visual assistive equipment. There are conventional approaches that most of us are very familiar with, such as the use of hand magnifiers, which enlarge print and might enhance the contrast when there's illumination. There's stand magnifiers, which work to provide sometimes even greater clarity and often are used for patients who can't hold their hands steady. And there's electronic magnification, which offers even greater magnification and contrast enhancement. As we wrap up things with patients during this 45 to 60-minute visit, we review all of our findings with the patient. And we talk about how our treatment sort of spans 4 different areas. Vision enhancement with glasses or lenses or optical devices. Sensory substitution in cases where we can't enhance the vision enough to be able to achieve a goal. And we spend a great deal of time in education and counseling. It's very, very scary to lose vision. And so patients have many questions, and we're afforded this wonderful opportunity to spend time together with our patients and be able to explain to them what they might be able to expect and how to manage these issues going forward. And after our visit, we'll typically refer them to occupational therapy, where a lot of the hard work really begins.
Hi, my name is Kristen Shiflett, and I'm the occupational therapist here at the Lions Vision Research and Rehabilitation Center. After the patients see the doctor, they come see myself, the occupational therapist. We get to know each other and get to develop the goals that the patient wants to work on in the clinic. As you can see, I have a large clinic area to work with together. We try to mimic it like the home of the patient if possible. So the first section here, we have like a kitchen table. You have the light coming in from the window. And kind of think of people when they have their breakfast at the table reading the newspaper. And we also have additional lighting for patients to try as well. Also in this room, we have the TV and the comfy chair, which is very important to our patient. We want to be able to watch TV for pleasure with family or learn about the news if they're unable to read the newspaper. So really focus on different ways to improve their quality of life with the TV. Also, in our clinic, we have the kitchen. A lot of our patients have difficulties here in the kitchen because of the lighting and also because of trying to look at the appliances. So here in our microwave, we have a bump dot, which is a raised textured dot on that 30-second button, which is my favorite button on that microwave, because it makes it quick and easy. So if you need 2 minutes, you'll hit that button 4 times for 2 minutes. If you look to the left, we have our kitchen setup. Very undermount lighting is very important for our patients, as well as contrast, which Dr. Goldstein talked about as an important measure that we look at in the clinic. When cutting food, we would want them to cut food with high contrast. So we have the black cutting board here, and we have a banana. So the banana stands out more on a black cutting board than the white side. Over here to the left, we still have more examples of high contrast with food. A lot of our patients, again, with eating, it's hard for them to see that detail that they have on the plate. So again, having the high contrast, so having a black plate with white colored food is helpful, and then the white plate with dark food to help stand out. We continue going through the clinic. A lot of our patients are still working, or they want to use the computer to help communicate with family in their everyday lives. So we have an Apple and a PC computer here for our patients to talk about the accessibility. Note, we also have many types of keyboards. These keyboards are high contrast, so we have a yellow keyboard with black letters, very large letters, so it's easier for them to see for typing. And then also we have on the PC here, the Apple, we have the black background with white letters. Gives it more contrast and a little bit easier to see when they're typing. When glasses and magnifiers don't work, this is the next best thing. This is electronic magnification. Electronic magnification not only makes things bigger, as you can see here, I have a regular letter, put it underneath this machine, It's displayed onto the screen. It's larger, but also has contrast. So we typically look at paper, it looks like so, regular color, hard to see. As we increase the contrast, it can be brighter and a little bit easier for the patient to see. A lot of our patients benefit from these for a lot of reading activities, whether it's work or at home. These devices, unfortunately, are not covered by insurance. They're somewhere between $2,000 to $4,000 depending on the device. We do reach out to state agencies to help pay for these devices, but some of our patients don't meet that criteria. So we depend on grants and funding of the community, but also Lions like yourselves who recognize that patients reach out to you to recycle their devices, and we therefore give them to other devices or other patients in need. Lastly, as we go through the clinic, we try to mimic things to look like they're home again. So here's some closet to pick out clothes. A lot of patients say the clothes look like similar colors. So trying to pick out a gray shirt versus khaki pants, sometimes that can be tricky. So we practice this together. And then lastly, the grocery store. Big deal for our patients as they want to be as independent as possible. So we do have labels here that I did receive from the grocery store. And then we have food items for them to practice using the hand magnifier or portable magnifier to do the activity. A lot of the other things we talk about in the clinic, technology is huge. We do have head-mounted technology that can be practiced with our patients. And obviously any new research opportunities, we will practice those with our patients as well in clinic.
We're very fortunate to be supported by the Lions Vision Research Foundation. It is because of the Lions Vision Research Foundation that our center was endowed many years ago for the purposes of doing research. The funds that were raised by the Lions enable us to continue to find new ways to help people with vision loss. These plaques hang in our clinic, and we are so proud of the history that the Lions bring to our center and feel very fortunate that they continue to work tirelessly to help us do the work that we do each and every day. In our clinic, we have listings of all of the Lions who have been named Arnold Patz Fellows. Several of you on this Zoom call today at this rally are Arnold Patz Fellows. And again, we're very grateful to you for your support. Thank you, Lions, for joining us on the tour today. We're so fortunate to have so many great minds, researchers, teachers, clinicians, all in one great space working together. But we're even more fortunate because of our partnership with the Lions. It's because of you we're able to do this great work. And our future really lies in your continued support and our ability to serve the patient community. We hope that you will continue supporting the program, supporting the fellowship, that forever we'll be able to continue to train individuals to care for people with vision loss.